Hi, yes, thank you, Francis. Good morning, everyone. Happy Friday. Thank you for joining us today. My name is Brenda Nunez. My pronouns are she, her, and hers. I work for Star Vista, and I am the co-chair for our Diversity and Equity Council.
Thank you. Good morning, everyone. My name is Frances Lobos. I use she, her pronouns, and I am also a co-chair for the Diversity and Equity Council. Welcome to our second town hall on race and COVID-19, our community input session. So we're giving everyone a few minutes to sign in and get settled. So we'll get started shortly, but as we wait, we would like to take some time to thank our partners that have made this event possible. First, my co-moderator, Brenda Nunez from the organization Star Vista, Lisa Teeler, Executive Director of the Bay Area Community Health Advisory Council, Shireen Malikafsali from Senior Manager for San Mateo County's Public Health Policy and Planning. Thank you for all your support, and also our Office of Diversity and Equity, Dr. Maria Lorente Foresti, Tania Perez, Annette Pacchayan. Thank you so much for all your support. So 2 quick announcements as we wait. This event is being recorded, and we will have interpretation services available, and I will have more instructions for that shortly. So we'll give it a few minutes and then we will begin. Thank you. Okay, so it is 11:03. We're gonna go ahead and get started because we do have a very tight agenda. So if I can go to the next slide, please. So we do have interpretation services available. So if you haven't done so already, I would like to please invite you to click on the globe icon on the bottom of your screen and select a language. Even if it's English, you need to make a language selection. And if you're on the phone or an iPad, there should be a more option or 3 little dots that you can click in order to select your language preference as well. And then a reminder for ourselves and for all of the speakers today to please speak slowly and clearly so that our interpreters are able to capture everything that is being said. Also, being mindful of any acronyms that may come up. Next slide. Thank you. And just another, again, reminding everyone that this event will be recorded and that we will post the recording on our webpage for public view. And so with that, I'm going to turn it over to Brenda to go ahead and talk about some of our housekeeping items for today.
Awesome. Thank you so much, Francis. Yes. So yeah, a few some housekeeping items before we get started. Everyone will be muted during this event. The screen share option is also disabled. You will all get an opportunity to speak during our community input session. During this time, if you wish to speak, please use the raise hand button to be unmuted. And if you are joining us via phone and you also wish to speak, please use the thumbs up button so that you can be unmuted. Community discussion session, during the community discussion session, please keep in mind that just be mindful of time, and all speakers will have a maximum of 2 minutes to speak. During the whole event today, please feel free to use our Q&A feature throughout the event. We will make sure also to allow some time to hear from people joining us on the phone. All the information today, that presentation, the resources, and the recording of this event will be made available to you after the event. We also welcome your feedback that can be provided via phone or email. Our contact information will be provided at the end of the presentation. Yeah, thank you so much. And then, so for our agenda, so what today's going to look like. The first 30 minutes we'll spend in, we did introductions, and we will also provide some updates since our previous town hall in May. The majority of this event will be dedicated to community discussion and public comment, where we hope to hear from all of you. And then we'll end the presentation with some next steps. And we'll hear from Lisa, who will tell us our goal for the day today.
Thank you, Brenda. Good morning, everyone. My name is Lisa Taylor, the Executive Director of the Bay Area Community Health Advisory Council. I'm also a member of the African American Community Initiative, which is part of the Diversity Equity Council. As some of you may have remembered, the last town hall was mostly updates, and then we spent some time talking to the community. This time we're going to reverse it. So I'm going to go over our intentions for the day. One, we're going to be learning key priorities from the community, building community relationships within San Mateo County. So that consists of our consumers, our community-based organizations, government entities, and small businesses. And we're going to identify some action steps. Next slide, please. In order for us to accomplish our goal and create a safe space for everyone, I'm going to go over just a few of the points of the Cultural Humility Group agreements. As you can notice on the screen, it's in both English and in Spanish. We definitely want to prioritize our community voices, and we want to prepare our leadership to really listen to you. So here are some of those agreements. Listen as if the speaker is wise, listen to understand. Another one, a few bullets down, is to be disciplined about not making assumptions. And then one of the last ones is to pay attention to what moves you. Use out, oops, or ouch. So thank you for listening, and I will pass it on to my colleague, Shireen.
Thank you, Lisa. I'm Shireen Malik-Kavzali and work at Health Policy and Planning and County Health. It's really great to be with all of you here today. Before we dig deeper into our town hall on race and COVID, I'm going to go over a couple of slides to ensure we all have some foundational information. We wanted to share some definitions of racism. We often think of racism at the individual level, which is what is often highlighted on movies or TV, where an individual or individuals exhibit prejudgment, bias, or discrimination based on the race of a person. This can be in blatant forms that we're seeing today with COVID, where our Asian brothers and sisters are being called racial slurs, being confronted with terrible statements, as well as microaggressions and unconscious bias that people of color face on a daily basis. Institutional racism elevates the level of policy to the level of policies, practices, and procedures that work better for white people than for people of color. And this can often be unintentional. This is how individual institutions like hospitals, workplaces, immigration systems, libraries, every institution you can think of, banks, are set up to serve white people and often exclude people of color. An example of this is just thinking about who's being hired, who's being promoted, what does leadership look like? Where are services located? Who gets suspended at school or arrested on the street? Versus getting a slap on the wrist. The caliber of healthcare we're receiving. Specifically, for example, research has come out to show that emergency responders are not providing the same level of pain medication to Black clients versus white clients for the very same symptoms and requests from clients. And then there's structural racism. That's how institutional racism shows up in each and every one of the institutions we connect with. That's the history and the current reality of these, of how institutions across all institutions affect people of color negatively. This is when we start to feel like racism is in the air that we breathe. It's in every institution, every place that we touch, and every individual we connect with. that a person of color is disadvantaged from the moment they are born in an institution to their schooling, to their workplace, and more. And this adds up dramatically. And COVID's exacerbated and exposed these structural racism, with over 60% of us in San Mateo County being people of color, and in some census tracts that being up to 98%. All levels of this racism are playing out with the majority of our San Mateo County residents on a daily basis, and especially making this uncertain COVID reality much more challenging and painful to navigate. Next slide. And this individual, institutional, and structural racism impacts our health in every setting and place. And as we can see from this pie chart, clinical access and quality, while critical, are only a small slice of the pie of what creates our health. So health doesn't happen in a doctor's office. Data shows that where you live, go to school, work, the economic and social factors in your life have the vast impact on how healthy you can be. And as we just discussed, all these factors are related to the institutional and structural racism that we face. And as we shared earlier, the economic and social factors in our communities are not distributed equally, even though people of color are the majority. So with these kind of foundational settings, I'm going to turn it over to Brenda.
Shireen, thank you so much. And I'm going to introduce Anna and Maria to lead us through the next part. Thank you.
Yep. Hi, everybody. My name is Annette Pak-Troyan. My pronouns are she, her, hers, they, them, theirs, and I'm the LGBTQ community outreach worker for the Office of Diversity and Equity. COVID-19 has created both a public health and an ensuing economic crisis that's affected everybody in our county. We're all on this unprecedented journey, but our communities of color, our low-income communities, and our LGBTQ+ communities have historically been marginalized, and we're already starting this journey behind the 8 ball, right? So our most impacted communities are often essential workers on the front lines of exposure. Impacted communities who are also already experiencing housing, job, and food insecurity, and increased chronic health conditions. With COVID-19, these challenges have really reached a tipping point. For example, more than 1 in 5 transgender adults have at least one or more existing chronic health conditions. And the fear that comes with discrimination that's experienced and mistrust of our health providers keeps many trans folks from going to the doctor. So this really creates a higher risk for the negative outcomes of COVID. San Mateo County is very diverse, as Shireen explained. Over 60% of our population is people of color across the country, and in some of the census tracts, that's up to 98% people of color. I would like to pass it on to Maria to continue on in this part.
Hi, thank you all for being here. My name is Maria Lorente, and I'm the Director of the Office of Diversity within Behavioral Health and Recovery Services. We know that significant health disparities exist along the axes of age, sex, gender, and race ethnicity, which is reflected in the distribution of chronic and life-threatening conditions, birth rates, and life expectancy. Preliminary data suggest this is also the case with the COVID-19 pandemic. For example, we know that rates in different areas seem to be higher among the Latinx, Black, and Pacific Islander communities. The data and range of variables helps us effectively direct resources to vulnerable populations, develop evidence-based responses to the continued spread of COVID-19, and provide members of the public with an accurate picture of their risk. No variable works independently. Socially relevant variables such as age, gender and sex, race and ethnicity, and comorbidity status are in constant interplay. Therefore, working to learn and understand the data and how its interplay can help us best support our communities and prepare for the needs of our vulnerable and most impacted communities is important. San Mateo County has made our data easily accessible and available to the public as a way to guide our prevention and support efforts. As you can see in this slide, we do have some communities impacted disproportionately. As of August 5th, San Mateo County's COVID-19 data shows that we have 5,891 cases and 120 deaths. The Latinx community continues to be disproportionately impacted with COVID positive results. As you can see here, 49% of the community is testing positive. However, the Latinx community makes up 20% of our San Mateo County population. This is followed by whites and Asian communities. The health data dashboard can be found at www.smchealth.org/coronavirus. We would like to share that tracking the pandemic has been compromised by a massive breakdown in the state data system for tracking tests statewide. While the public health team works with the state along with other counties to stand up alternatives to this system, please do not rely on any of the data on the dashboard that relates to testing until we report that the state problem has been fixed. It is heartening that our COVID-related hospitalizations, which are still accurately reported, have been declining and are well within our available capacity. Now I'd like to welcome Tanya Perez from our Office of Diversity and Equity to discuss social determinants of health. Thank you.
Hello, everyone. My name is Tanya Perez. I'm a community health planner at the Office of Diversity and Equity, and my pronouns are she, her. So in the previous slide, as Maria illustrated, we saw that there was a very large disparity. Currently, the Latinx population makes up about 49% of the known cases of COVID-19. So how do the social determinants of health and various levels of racism tie together to create these disparities? According to the CDC, long-standing systemic health and social equities have put many people from racial and ethnic minority groups at increased risk of getting sick and dying from COVID-19. Individual behaviors such as washing your hands, staying 6 feet apart, and wearing a mask are amazing and protect all of us. However, folks from hard-hit communities also have to consider other factors outside of their individual control. Some of these reasons include, 1, discrimination and racism that affects outcomes in healthcare, housing, education, criminal justice, and finance. And racism itself also leads to a lot of toxic and chronic stress, which has been linked to deteriorating health outcomes. The second is healthcare access and utilization. People from racial and ethnic minority groups are more likely to be uninsured than non-Hispanic whites. Access is also limited by transportation, childcare, being able to take time off work, language barriers, and cultural differences. Also, folks may hesitate to seek care because of distrust in healthcare systems, as Annette stated with the situation with our trans folks. Occupation. Marginalized folks are overrepresented in essential work, just as we shared before, such as healthcare facilities, farms, factories, grocery stores, public transportation. They have greater chances of being exposed to the virus because they cannot work from home. And if they do get sick, sometimes it's very hard for them to be able to miss work that way. And then lastly, housing. One of the main things that we've noticed during this COVID pandemic has been the crowded conditions that make it challenging to follow prevention strategies. There are many multi-generational homes within our county, and also we have growing unemployment rates that put marginalized communities at greater risk of eviction, homelessness, or having to be put in a situation where they are forced into shared housing. So what does this all mean? The next thing that we're going to be talking about is a brief example of potentially someone from the community, and we'll be able to see the individual choices that they can make, as well as the structural barriers that are in place for them that maybe they don't have a lot of control over. So we'll be sending an article. There was an article published in the New York Times that talked about crowded housing. But one short example could be, for example, server at a restaurant. She lives with her children. She lives with her elderly mother. Her husband is a construction worker. She was put on temporary leave when dine-in was closed, and there was a struggle. Currently, her children are out of school, and it is unclear whether they will return in person. Once the restaurants opened back up, she was excited to get back to work, but really scared that she would bring back the virus to her family, especially her mother, who has diabetes. This person wears a mask. They have PPE available by their employer, but there's still a lot of fear. She washes her hands as much as she can, but there are still folks that dine in at this restaurant that do not wear a mask when they come or take their mask off when they're eating. And so she's having a lot of contact with those folks. However, she cannot stop working. This brief example shows us the intersection between individual choices of hand washing, maintaining distance, also put in place with economic factors, as well as some social determinants of health. So I will now pass it back to Francis. Thank you.
Thank you, Tanya. As we get ready to provide the space for community input, we'd also like to share some updates on San Mateo County efforts. We had presentations at our first town hall in May, so we wanted to just hit a few points. I'm going to provide a general overview of the Board of Supervisor updates, but we'll hear more information in detail in the coming slides from San Mateo County Health and the County Manager's Office. So the Board of Supervisors at this time is continuing to respond to COVID and focus on recovery, specifically chairing the Recovery Coordination Committee and funding towards supports and services. And these services include childcare, expanding public Wi-Fi in areas like East Palo Alto, the North Fair Oaks area, as well as the coast. Increasing immigrant defense fund as well as immigrant relief, and also relief funds for small businesses, nonprofits, as well as rental assistance. The Board of Supervisors is also focusing at this time on the infrastructure for health and hospital response. They are leading the COVID outreach and information across the county and passing policies and resolutions to support our communities, including moratoriums on residential, commercial evictions, as well as increasing rents. Recently, the Board of Supervisors also passed a resolution supporting Black Lives Matter and also declaring racism as a public health crisis. In addition, they also supported the creation of the Office of Equity and Social Justice that will be working under the Office of Community Affairs. And so to provide more detail on all of this, and specifically in health, I would like to now introduce our Chief of San Mateo County Health, Louise. Are you here, Louise Rogers?
Hi, everyone, and so good to see
Welcome.
so many people on the list making time to join this conversation today. It's a great way to have a Friday. I wanted to just take a few minutes to update you on some things, but I am so grateful to the ODE staff for actually covering many of the main points already. I think it's just a sign that we are managing to remain connected in these really challenging times. Next slide. So I wanted to start by just stating perhaps the obvious, that every day really brings amazing new challenges. But I am so grateful to all of you, and I scanned down the list to see, who is a part of this discussion today. And there are so many examples of ways that each of you are helping us lift this enormous challenge. And today, I just want to acknowledge that one of the things that I'm most grateful for is all of you really creating the space for us to take a step back and think about the deep underlying problems that we actually have to work on over many years and that we have to continue to lift while we look for opportunities to take immediate action to address the underlying causes of the disparities that we're seeing and that were so well shared regarding the pandemic, which has just exposed these problems more deeply. So we're really in health remaining laser focused on supporting the community to prevent the spread. As I said, I welcome the opportunity to reflect and take a step back. And we are seeing that the spread is really focused in low-income communities, and the demographics that Annette shared actually closely match our Medi-Cal and ACE uninsured demographics in the county. And they're very, very consistent with the demographics of poverty, which, as you all know, are not equitably shared. And what we're seeing is people who really can't afford to isolate. They work frontline jobs. There are many barriers, and that New York Times article actually, I think, really described what we're talking about, multiplied many times. The challenges that people face in losing income and perhaps working in jobs that will be lost, making rent, food, dependent care, and fundamentally the trust that needs to be present in order for someone to actually engage with our public health contact tracers, which now includes many other public servants who have stepped into those roles. That fundamental trust that has to be present for people to be willing to work with us to actually take steps to isolate and to manage all of those risks that they live with and that their households live with. Crowded housing where the spread is virtually impossible to contain, and we are seeing a lot of the challenge in gatherings. So next slide. I don't need to get into the details about this next challenge because it was already described. The whole state data system has collapsed. And so as we've made great efforts to get the data on our website to be more responsive to local needs, including improvements that you all advocated for and that we were able to make, including future improvements that still have to be made. Right now, this week, I ask that you really not rely on that heavily, and we'll be sure to send out a really broad notice when we see that that data is back in shape again. Next slide. And as you all know, as a result of the pandemic and the state's decision, despite our local advocacy, we have seen more closures. And I just wanted to take a minute to say that the health officer's strong opinion on this has been that these local closures, for example, of hair salons and barbershops, they really are not indicated by our review of the data to be highly involved in the spread. And so we haven't felt that those additional closures would really help our situation locally, and we know that they have caused additional economic hardship. So I think it's important for you all to know that if we felt that those closures would be helpful and have a positive health impact, our position would be different. But we really don't see that connection. And as I mentioned, the deep causes of the spread that we are seeing really are poverty, and that's what we need to work on to support people. We are trying to mobilize some new initiatives to try to support the folks that we identify who are positive, and we hope to have those pulled together in the next couple of weeks. But particularly what we're trying to do is provide the people who have been identified as positive with very specific case management and supports to help them access the financial and other resources that can help people when they are in this time of need. There are a lot of things that have been pulled together by the county and local partners. One example would be the Mission Asset Fund, which is the managing the immigrant relief fund that is now available. The core service agencies have been mobilized around rent assistance, and we will be partnering with a nonprofit to be able to wrap around our most complex families that need these additional supports and enable them to be able to isolate more successfully than they have been able to. And then finally, it is true that these behaviors that we believe can make a difference are important to emphasize for everyone. And those of you in this group who have special influence over your peers and community members, it's important to acknowledge that the root causes of this disparity in the experience of the pandemic is fundamentally poverty, and we have to go after those root causes, but we can all play a role by trying to comply with these behaviors. Next slide. I also really want to express gratitude to the many, many people that have stepped into the work of contact tracing who are mostly, they're public employees that have been reassigned. It's pretty extraordinary to see the resilience and talent that has come through in this group that we have been working with and training and helping them take on a caseload for contact tracing. And there will be more people that we're adding until we have about 140 in another few weeks. And these are the folks that they are really the frontline response to people who have been determined to be positive, and the people who can help those folks isolate and quarantine. And next slide. So in closing, I also just want to acknowledge and express gratitude for a lot of progress that has been made. It has been mentioned, but we are really trying to ramp up the ethnic and linguistically targeted outreach strategies through community affairs, leveraging the amazing Census outreach work. And we do intend to leverage all of our health equity initiatives networks to try to get the word out. The crushingthecurve.me campaign with Bay Area counties targeting youth and young adults for support and resources. There is a County Recovery Coordination Council, which I sit on, and Peggy will also be able to mention, and the subcommittees of that effort that really focus on long-term recovery, including a specific equity frame, which has already had influence. The subcommittees that are a part of this recovery effort under the steering group include committees that focus on economic recovery, vulnerable populations, community infrastructure, and education and childcare. And at the top, with a dotted line into the whole effort, and with already having mobilized key questions that need to be asked of each initiative that is brought forward, is an equity committee that has already had impact and influence. So I'm very grateful for that work. And I must say that I'm very grateful to work in a county where the whole effort of responding to the pandemic involves many, many partners countywide. And then I also want to mention that we had a first forum specifically on advancing equity in county health for all of our staff and partners. And there's a second forum coming. And I hope that many of you will participate in that. I really see this as an opportunity to figure out real action steps that we can take locally and within our influence to be able to move the dial on equity and eradicating racism. And then lastly, testing has been a major focus, and we continue to work with the county manager's office to make the testing strategies more effective. So thank you, everyone. That's all I had to share at this point, but I'm eager to hear from all of you.
Wonderful, Louise. Thank you so much for being here today. Next, we will be hearing from Peggy Jensen with the City Manager's Office. Hi, Peggy.
Hi. Good morning, everyone. Thank you very much for inviting me to participate in this really important event this morning. So Louise, I'm going to be very brief because Louise did a lovely review, highlights of the work that we're doing around our COVID recovery long-term planning. And what I'd like to do is just really focus on the accomplishments to date and highlight some of the impacts that the Equity Review Committee have had on this work. But before I do that, I'd just like to point out that I think there are a fair number, I see 3 or 4 people, at least on my screen, on this call who were on the Equity Review Committee. So if you all have any comments you'd like to share about that process, I'd be happy to defer some of my time to you. But going to the bottom of the slide, in terms of accomplishments to date, as Louise said, we have an equity guiding statement for our entire recovery initiative. And that was developed by our equity community. And it's the guiding statement, but actually the really most important part of that process is the 4 review questions. Actually, there are 5 questions that we're asking every committee that develops a recommendation toward recovery, whether it's a short-term or long-term recommendation, we're asking them to review those questions. And those questions start with asking who was at the table when this approach or this recommendation, this policy or program was developed. We're also asking what data has been used to support this recommendation. We're asking who's going to be burdened and who's going to benefit from this. Are there specific groups that will have will have to deal with unintended consequences potentially. And then also the fourth question has to do with how is this information being shared? How is it getting out? Is this available to everyone in a way that they can easily access it, that they can easily understand what the benefits are, and that they can share it with appropriately with their community, whether that's culturally appropriate or linguistically appropriate. So those are the questions, the four questions that are asked. And then the final question is, if there are issues, if issues have been identified or gaps have been identified with any of the four other questions, what's to be done? What are the recommendations? And through this review process, this equity lens has been applied to the messaging campaign the county put together, and adjustments were made to that based upon the recommendations of the committee. They've also reviewed a geographically targeted business assistance program. Again, recommendations were changed. And in fact, they're starting at the very beginning of the process as we build our renter and small property owner assistance program. Equity committee met yesterday to provide input on that. So lots of work being done, significant focus on equity. And in terms of timeline, our plan is to have our report available by the end of the month. So thank you.
Wonderful, Peggy. Thank you so much for being here today for the updates.
My pleasure.
Alrighty, so we also have some updates from the Office of Community Affairs and Census 2020. And because we are running behind a little bit on, with our schedule, I will briefly go over some of these updates. And just as a reminder, all this information will be available to you after today's presentation. The Office of Community Affairs was excited to share that we have exceeded our 2010 response rate. As of August 4th, we are at a 74.1% response rate. Enumeration is scheduled to begin on August 11th, and this time it will be ending a month earlier, and it will be ending on October 31st, 2020. As you likely seen on July 11th, the Trump administration released a memo declaring that undocumented immigrants will not be included in the apportionment count. This is a serious attack on fair representation. The Board of Supervisors approved a resolution on Tuesday, August 4th, opposing this memo. And this can be accessed online, and we will provide you with a link after the event. Let's see what else. Yes, another round of targeted postcards will be going out to the areas of low response. The Office of Community Affairs is also working with partnering agencies to help via person and virtual questionnaires at assistance centers. For more information, you can you can log in online to my2020census.gov to participate and to follow the updates. We can also follow us at SMC_COMMA affairs. This could be on Twitter or Instagram. Thank you.
Awesome, thank you, Brenda. So finally, before we get into our discussion and why we're here today, the final update is from San Mateo County Economic Development Association, or SAMCEDA. So they finished their first phase that went through March, from March to May. They provided 350 grants that totaled $3.5 million to support businesses through San Mateo County Strong Fund. They've been monitoring small businesses through the implementation of surveys. On August 4th, the Board of Supervisors approved $200,000 additional funds to support the Renaissance Entrepreneurship Center. And this will be 30 to 40 grants of an average size of $5,000 for businesses that meet low-income criteria in targeted areas of the county. The funds are to be used for trainings, purchase of technology, and personal protective equipment and safety capacities to meet COVID needs. Wonderful. Next slide. So with that, I want to turn it, as we get ready for the discussion, turn it back to Shireen to go over the community priorities that have been identified today.
Hi, everyone. When COVID hit, we immediately connected with a lot of our community partners, particularly through our Community Collaboration for Children's Success Initiative, and collectively developed a list of community priorities and needs for COVID, especially prominent for our most impacted communities. We also received really great feedback from participants in the last Race and COVID Town Hall on May 1st. You should all have a copy of the detailed document with many of your comments and feedback included, and I know Annette will be sharing the link also shortly. We just wanted to go through them really quickly because we want to turn the discussion at the end over to how this might be changing, what might be missing, what else we could add to it. We know that we need access to easily accessible, culturally appropriate resources and information. We need support navigating information and services and filling out forms. Most of us have never been at this level of crisis, and many resources are brand new. Given the racism, xenophobia, and discrimination, we need to come together in solidarity explicitly to promote equity and justice. Basic needs are more challenging than ever across housing and food, finance, and healthcare. And while sheltering in place, if we don't have adequate internet and cell data and access, that means our children can't go to school. That means we don't have information, we can't see loved ones. Education and childcare are more difficult for essential workers. We don't have enough personal protective equipment, paid sick days, worker protections for our frontline workers. And mental health is challenged more than ever with increased anxiety, depression, isolation, and domestic violence is on the rise. And transportation for essential needs and workers is more difficult and expensive than ever before. But this is a really uncertain time, and needs and priorities are changing constantly. So we're really looking forward to hearing from you on what's missing, what needs to be changed, adjusted, moved around. And so now I'll turn it over to Brenda to open it up for community discussion.
Awesome. Shireen, thank you so much for reviewing those community priorities. Yeah, so as we move on and we start thinking about our community discussion and public comments, let's keep those priorities in mind. Just as a reminder, during this time, if you wish to be part of this conversation, please use the raise button option so that you can be unmuted. For those of us joining us on the phone, you can use the thumbs up and you will be muted when it's your time to speak. Again, we are being mindful of time. We hope to hear from as many people as we can. We ask that you speak for 2 minutes. After 2 minutes, we will ask you, we'll thank you for your time and we will ask the next person to speak. If you have any questions during this time, we want to refer you to the Q&A feature. You can enter your questions there. And yeah, I want to invite everyone to start a conversation, and I'm actually going to send it over to Francis in a second, but just make sure that we make this a supportive and safe space for everyone. Thank you.
Thank you, Brenda. Absolutely. So as we get started, we'd like to first open it up for discussion. Our first question to the group is, what has changed since May? If you had the opportunity to join us during our first town hall, a lot has happened since, and so we really want to get first your input on the changing landscape, and then talk about how we need to adjust or possibly change the priorities that we just listed. We will dedicate some time during this next hour or so, about 15 minutes at the end, for any questions. And we want to acknowledge that we may not have all the responses today, but we are documenting all of the inquiries. So if any questions come up, we really encourage you to type them in the Q&A so that we can gather them at the end of the event and then provide you with follow-up information and materials. So with that, our colleague Tania Perez is going to be supporting us to moderate. I believe we're going to start with people that are joining us on the phone. So 2 minutes, hopefully, so we can hear from everyone. Tania, do we have anybody on the phone?
Yeah, so we have someone on the phone. We also have someone with a raised hand, so I'm going to go ahead and call on them. Karnam, I'm going to go ahead and unmute you. 1 second. Okay, go ahead.
Okay, can you hear me?
Yes.
Okay, good morning, everyone. Thank you so much for this town hall, and I'm looking forward to looking at the results from the last town hall. I just wanted to share that we've been doing a lot as peer-run agencies to address these 2 pandemics. I do appreciate the focus on COVID, but I also want to make sure that the discussions around racial equity and bias don't get overshadowed There's certainly a lot for us to consider as a world and as a nation and as a local county. One of the things that Heart and Soul is doing is joining with California Clubhouse and One East Palo Alto to continue a conversation with Reverend McCall, and it's entitled White Privilege, Institutional Racism, and Being an Ally. This is actually part 2 of a conversation that was already started. And I want to put in the chat the details for this upcoming community conversation, which includes our Zoom meeting, because we're working on 2 streams, working on COVID for sure, and then mental health is so central to both of those. People feeling safe physically and emotionally. And so racism is certainly continuing to, and structural as well as institutional racism is playing such an important role right now in our overall health as a county and as a people. And so we definitely want to invite the community to have a chance to just share vulnerable experiences, share their voice about how racism is impacting them either vicariously or directly. So thank you.
Thank you so much.
Cardam, thank you so much for extending that event invitation to everyone.
Absolutely.
We look forward to the information in the chat. All right, it looks like we have another hand up. Charo Martinez, I'm going to go ahead and unmute you. Charo, are you there?
Oh, thank you, Tanya. Sorry about that. Good morning, everyone. My name is Charo Martinez. I work at the Office of Diversity and Equity within Behavioral Health and Recovery Services. And I'm very happy to be here, and thank you all for the important information that was provided. Following the data that we all received, I was wondering, and I have to say that I have the privilege to be coordinating a group of community members and consumers from BHRS. The group is called the Health Ambassadors from our Health Ambassador program. And precisely last night, I was collecting a lot of concern in terms of how to isolate when I am not able to do it, when I cannot afford doing it. So my question would be, has it been considered offer hotel rooms to those who cannot afford isolation, as it has been offered to homeless community, even in other counties, or I don't know if it has been offered here in San Mateo County. Yeah, that's one of my questions and concerns just gathered from yesterday's meeting. I have to say that in our group, we have suffered the loss of 3 lives, spouses and relatives from our members, and isolation is one of the biggest challenges that our families face right now. Thank you, Tanya.
Thank you, Charo. So I think another way that we could also look at this, I don't see any hand, oh, I see some hand raised. So we'll go forward. But what I was gonna say is, you know, we have all this data, we have these numbers, right? And we really wanna be able to put stories behind the numbers and really show community member input to see what folks are facing that we might not be aware of. So just think about that, I think, as we go forward as well. Okay, next is Nora Razon. I'm gonna go ahead and unmute you. Nora, are you there?
I'm here. Can you hear me?
Yes.
Great. I mentioned this question in the Q&A, but I want to share with everyone because I'm wondering just if other people know the answer. I work in East Palo Alto, and some of the concerns that I've heard in East Palo Alto are around the risk that some families feel they're taking and getting tested for COVID and testing positive, and then what? And I think the concern that I'm hearing is if I can't leave my house and I can't go to work, and if I don't go to work, right, what we know is I don't have an income. There's all these things that will happen. And in my mind, I'm thinking, well, if that happens, how do we make sure that we can get food delivered to your home from the local food bank, that you can get you can move up in priority for the financial assistance and the rental assistance that is available. And like, how do we create a resource that's like this one pager, perhaps, that residents are receiving when they go get tested, and that it's kind of common knowledge in the communities that that we have your back. And I know that we have resource guides that are just for everyone, but how can we make that guide a little bit more specific to families or residents that are testing positive, and that have like delivery options attached to those resources? So that's kind of some comment and a question that I want to pose to the group.
Okay, thank you so much, Nora. And when we get to the section for the answers, we'll see if we kind of have an answer for you, okay? Thank you.
Thank you.
Okay, so next on the list is Mary Bernier. Mary, can you hear us?
Yes, I can. Can you hear me?
Yes, we can.
Thank you. I'll try to read my little notes because I don't want to go over 2 minutes.
Okay.
So I've been trying to register people over here in Half Moon Bay to get tested. I'm only using a Spanish flyer, which was hard to come by, and I feel really sad, but I'm grateful that you guys are having the meeting, and I'm excited to talk with Louise Rogers, because one of the things she mentioned was she would like to help folks testing strategies and make them more equitable. In 4 months, I've been able to only register 15 people, although I was passing flyers out for 4 weeks at Our Lady of the Pillar, and 2 of those weeks the priest actually was reading the whole flyer. But a lot of people are working, and especially when I'm on the street talking to people, all of the Project Baseline tests in the 6 cities in our county since July 20th, because I don't have records before then, are from 9 in the morning till 3 p.m. in the afternoon. And our essential workers cannot take work off to get to those test sites. And I think it's really important that we start thinking about doing the tests in the evening. Weeknight is better than the weekend. A lot of people work on Saturday, and what people are saying is Sundays are one day off. They have a lot of stuff to do, if not just to kick back and relax and try to get their, preparing for the next week. So that would be the concern that I have. The other thing is, it was really hard to find a phone number that people without any medical insurance could call if they look at the list that gives the symptoms and they don't know whether they should be concerned about that or not. After several calls, I finally came up with the New Patient Connection Center's phone number, which is available from 8:15 in the morning till 4 p.m. in the afternoon, Monday through Friday. But it's fantastic that there'll be nurses available there to answer people's questions. Otherwise, we're passing flyers out. It's, just raises people's concerns, just as the last person said. we have to address, and on a leaflet's the only way I can, because I don't have the connections you folks do, but that it's not impossible if you test positive. However, how do we put that and not be liable by saying what we've said on our little one, and it's always in draft form, you know, just take extra precautions, and then we list the precautions.
Hello?
So those are two of the concerns that I have. I'm sure I've gone over 2 minutes.
Thank you so much, Mary. I think what you're bringing to the table is really important and sounds very much like an access issue. And thank you so much for the work that you're doing so far to address this disparity. We really appreciate it.
Thank you.
Okay, so next on the list is Craig Weisner. I'm gonna go ahead and unmute you, Craig. Craig?
Okay, I think I'm on now.
Yes, we can hear you.
Thank you. So I'm wearing a couple of hats today. I'm on the San Mateo County LGBTQ Commission. I'm also a small business owner. And one of the concerns right now that I have as a small business owner is that my neighbors are not going to get tested because the results of the tests are taking so long. I myself got tested over 18 days ago and have not gotten the results yet. So I'm concerned about that people are just not going to bother getting tested, even if they can, because the results are taking too long to come back. Wearing my other hat on the LGBTQ Commission, one of my big concerns is for the young people that aren't able to go back to school in the coming weeks, especially the LGBTQ youth who count on clubs and other gatherings at schools for the support that they need. And I'm just concerned that they won't be able to find that kind of support if they're sheltering in place. So thank you.
Thank you so much, Craig. Okay, next on the list, I see Ellen Darnell. Ellen, I'm gonna go ahead and unmute you.
Can you hear me?
Yes, we can, Ellen. Go ahead.
So it seems like a lot of people are raising concerns, so I didn't know whether to wait for the second part. But there's an area, I live in a county housing community for the mentally health disabled. And I hear us talking a lot about poverty being one of the main determinants. But what people seem to forget is disability hasn't gone up $1. We can't be included in unemployment. We can't get rental assistance because because our income isn't directly affected by COVID. So we're basically, to quote an old movie line, at the mercy of strangers. Whereas if you are not aware of particular resources that you can utilize, how to get things, every bit at the groceries, as I'm sure you all are well aware of, cost a little bit more trying to get somewhere safely. A lot of my peers will not ride buses, are afraid of the Ubers or Ready Wheels due to cleanliness standards. And even within our own community, we've received flyers on our door about how to take care of yourself, but there's never been any type of, masks have been passed out, but I see my neighbors all day, no mask, gathering. And I'm just wondering why the county can't work closer with HUD for all of the low-income properties for sometime help during COVID. I mean, banks are doing it, large apartment complexes are doing it. We know that there's an emphasis on the elderly, but if you are just disabled but do not fit into another category, you kind of fall between the cracks. Thank you.
Thank you so much for your comment, Ellen. I think as we have this discussion, it's important to recognize, the intersecting identities that a lot of the folks in our communities have. So thank you for bringing that perspective forward. Next, I have Lolan Sunga. I'm going to go ahead and unmute you, Lolan.
Hi, everyone. I'm Lolan from the San Mateo County Pride Center. I just wanted to kind of make a comment about Craig's concern about especially for the youth population, that they, especially with COVID, there isn't a place that they can connect with people, right? Because I think for the youth, they strive on physical contact with folks, and you're not, especially with COVID, you're not able to do that because everything's all virtual. But for the Pride Center, and I think this is super helpful for everybody in this room that works with the youth or even like young adults, that we do have groups at the center that specifically works for them if they need to speak to somebody or if they like need some type of connection. We have that there, and it's super helpful. We no longer have Andres Loyola, but who was the previous peer support worker for the center. But this is another way for people to kind of get connected with the community, especially with the LGBT plus community, that people don't look at that. You don't look at the demographics and things like that. So that's something that's helpful for them. Yeah, because I think it's really difficult, right? It's just how are folks supposed to navigate during this pandemic? But I think we're gonna be here for a while, so we have to like work together to find solutions. So thank you.
Thank you so much, Lolan. I really appreciate your input.
Thank you.
Alrighty, so I don't see any more hands raised. So go ahead and raise your hand if you would like to make a public comment. We really appreciate everyone that's shared so far, and I think that it's been really important for us to hear, like I said to Ellen, from different intersections of folks' identity. I think that that's something that we really want to push forward as we continue this conversation. It looks like we have a hand raise. Isabel Perez, I'm going to go ahead and unmute you.
Hola, ¿me escuchan?
Sí. Isabel,
¿Me
¿la
escuchan?
escuchamos? Sí.
Hola.
Hola.
Ya. Buenos días. Yo soy líder de la Asociación de Vecinos de Daly City y trabajo con la organización Fe en Acción en la ciudad de Daly City. Y hay algo que me preocupa porque a diario tenemos comunicación telefónica con muchas personas y muchas de las personas están muy asustadas de ir a un lugar a que les hagan el examen o de ir a un centro médico, hospital a que les hagan los exámenes, porque muchos de ellos no tienen la documentación, son inmigrantes indocumentados, lo que hace que el efecto del COVID esté concentrado en un lugar oculto por miedo. ¿Cómo se va a trabajar esa situación con esa población en las ciudades? Porque sé que en todo el condado está pasando lo mismo. Es una situación que va a repercutir como una bomba de tiempo más adelante, porque esas estadísticas no se están llevando ni se están teniendo en cuenta. ¿Cómo se está manejando esa situación? Y no sé cómo podríamos nosotros ayudarles, si es preciso, a mejorar la situación de la población indocumentada, ya que muchos de ellos, como lo dijeron ustedes, están viviendo en hacinamiento por la situación económica que estamos pasando en este momento. Muchas gracias.
Thank you so much, Isabel, for bringing that forward. As we talked about the social determinants of health and overcrowding and also discrimination, we can also be mindful of the fact that folks are very scared to get tested at this point, especially if they have undocumented status. And the steps that we can take to make it clear that this would not affect their immigration status or them obtaining citizenship in the future or any of that, and that their information is safe with us. So thank you for bringing that forward. So I wanna bring, we got something in the chat that I wanted to bring forward. So Reverend Chester McCall sent a chat to the panelists saying that food banks are being affected due to less donations. The Mouton Center has a food distribution program on Thursdays at 2, and for the last 2 weeks, the food bank has not been able to provide us with certain foods, especially meet the needs of our distribution. So this is another barrier, I think, to folks. Reverend Chester, would you like to speak? I see there's another question in the chat. Okay. One second. Okay. I'm going to go ahead and unmute you, Reverend Chester, okay?
Can you hear me?
Yes, we can hear you. Thank you for speaking, Reverend Chester. Go ahead.
Yeah, so one of the things that concerned me about access to food, and we talked about food certainty, is that we're not getting the protein, the meats. We're getting a lot of fruits and vegetables and stuff and bread, but the donations are lower than usual, and the food bank doesn't have the financial resources to buy the food that they usually buy to provide us, including eggs, all that kind of stuff, milk, cheese, which we usually get through the USDA program, which is United States Agricultural. So it just concerns me. Yes, we also serve a lot of folks that are undocumented, but we don't ask for that kind of information. So we have a lot of folks that come to us, and we've seen an increase since the virus and the number of people that we serve. And we have a very diverse community that comes through to get food. So, you know, I just need to bring it to people's awareness that food banks are being heavily impacted by this situation. Thank you.
Thank you. And Reverend Chester, you said something about when you went to go get tested, something about an email address. Do you want to speak about that as well?
Yeah. So when I went and got tested, and several people that I know went and got tested, it was necessary to have an email address so they could email you the results. What do we do about folks that don't have access to the internet, that don't have an email address? You know, what allowances or changes are being made so that those folks can also get tested? Thank you.
Thank you so much, Reverend Chester, for sharing that. I think, especially as everything has gone online, sometimes we forget, right, that not everyone has access to all of the technology that we have available to us. So thank you for bringing that forward. I see another hand raised. Alejandra Garcia, I'm going to go ahead and unmute you.
Hi, my name is Alejandra. Hi, Brenda.
Alejandra,
yeah.
We can't really hear you. It sounds really far away. Sorry, go ahead.
Could you hear me?
Yes.
No?
Yes.
Hi, I'm a high school student. Hi, Brenda. And I feel like for me, a huge barrier was that my mom, she works, she cleans houses, and for like a couple of months she wasn't working. So I feel like money was a big issue for us. And also my grandma, she's in the hospital right now because she deals with bipolar disorder and depression. So my mom hasn't seen her for months because of this whole coronavirus. So I feel like that has made my mom sad a lot. So it's been hard, I guess, for us. Thank you.
Thank you so much for sharing, Alejandra. I think, sometimes we focus on, the numbers and the rates and all of these things, and folks are still being affected, even if they do not catch COVID. And thank you for bringing that forward. I think that as we speak about work and social determinants of health and folks struggling financially, thank you for being vulnerable in this space. And letting us know how hard this has been and how your family has been affected. Thank you so much for sharing. Anybody else? Sorry. I see a hand raised. Mary Bernier. I'm going to go ahead and unmute you, okay?
I'm sorry I lost connection, so I had to run someplace, but I just want to give a little update if someone hasn't mentioned it. Craig brought up how insane it is that people are now having to wait 2 or 3 weeks for the results. There's a wonderful guy who's a lead at the testing site that I've been talking to several times, and he said just this Tuesday, he said, tell people that no news is good news, because and the health department people on the line would be able to confirm that if they haven't already, that if it's a positive test, you're going to get a phone call from the health department between 3 and 4 days. And that's very encouraging for people to know. And once again, I wish the Project Baseline, the whole thing would explain that to people, but that's from a very good authority. So that's helpful for us to be able to try to tell people so they do take the test. So many people won't. They think it's useless. Thank you.
Thank you, Mary. Okay, I see we have another hand raised. Pamela Ward. Okay. Pam, because of your version of Zoom, I need to promote you to a panelist and then you'll be able to speak. So just hold on a second. It'll do its thing and then you'll be able to speak, okay? 1 second.
Thank you.
Hi, we can hear you. Go ahead. It seems like there is
race, class, and economics are interrelated.
My concern has been throughout this pandemic.
Hello? It seems we're having a little bit of
I can't hear you. Race, class, and economics are related. My concern is the need to have a car for most people to have the test taken, that you have to have a car. To me, this is insane that they're not providing walk-up places for people to take the COVID-19 test. And this has been since the beginning of the pandemic, that people are not able to walk up to take the test. Thank you.
Thank you. Thank you for sharing. Alrighty, it seems like we have another hand. Alrighty. Mary Bernier, I'll go ahead and unmute you.
Thank you, Tanya. just in response, there are locations where you can do walk-ups. I'm not sure of others, but here in Half Moon Bay, they do not discourage it for the safety of the volunteers and people doing the testing, but you can walk up. If you could just ask your own place, if they can do it in Half Moon Bay, they should be able to do it everywhere.
Okay, thank you, Mary, for the information. All right, I see another hand. Allison, I'm gonna go ahead and unmute you.
Hi, can you hear me?
Yes.
Yeah, I actually, going back to what that other person said about the testing results and the no news is good news. I too have been tested and it's day 17, still no results. And so I was researching it last night and it seemed, I saw several articles that seemed to indicate that the labs are actually prioritizing the speed with which they're doing the testing. So if someone from the health department can speak to this, it seemed to me the articles were saying that they were prioritizing people who were the sickest in the hospitals, frontline healthcare workers, employees in nursing homes, et cetera. And if you had mild to moderate symptoms, you know, based on the screenings that Verily and other labs were doing, that they're pushing those tests back. So I don't know if the no news is good news is right, because I don't know that because if they're processing all the tests at the same time, then why not give the results? So it sounds like to me from reading the articles that they're just delaying processing the lower priority tests. So if someone could speak to that, I'd really appreciate it. Thank you.
When it's the right point, I'd be happy to respond to some of these in the follow-up.
Okay, thank you.
Okay, we'll let you know, Louise, okay? We have some time at the end, but thank you for being willing. All righty. Do we have any more comments? Oh, I just saw a hand go up. Men-Chun Wong, I'm gonna go ahead and unmute you, okay?
Hello, everyone. My name is Min Shun, he, him, or they, them. I'm a therapist at the San Mateo County Pride Center, and I was just noticing on the comments that several people have made around access, linguistic access to flyers that are in the appropriate languages, and the testing access and access to care in general. And I've noticed in the process that I'm immersed in at the center that sometimes I do come across people who don't have the technology to engage in therapy services through phone or telehealth because they simply don't have that kind of setup at home, nor do they have the privacy or the confidential space where they feel safe enough to engage in therapy services. So it is definitely a challenge at this point because of the challenges with not being able to do in-person services. And when we are trying to figure out how to do in-person services, we set up so many different ways of things that we think about, and it's not finalized yet, right? So at least in our individual case, that even when I do present some of these suggestions to people, then there's a lot of discouragement around like, oh, if I'm going to have to do X, Y, and Z in order to be seen by a therapist who's like in a mask with a face cover and all these things, it was kind of like discouraging for them, knowing that they also might potentially have to act a certain way in order to interact in therapy, where like the point is to just be yourself in those moments. So it definitely is a challenge in the mental health field for me that I am observing in what little I can see in the community, and not just the LGBTQ community, but also like a general at large, right? So when I say that I work for the Pride Center and see LGBTQ clients, that doesn't mean that they're not, any other intersection of identity, of race, gender identity, sexual orientation, whatever. And so I definitely respect the fact that we are given a lot more time this time to give public comment, because it definitely fell very short last time we had this town hall. And comments I've made in terms of the Q&A question, or stuff was like around Asian American experiences and personal experience with racism in the community that I hear while just grocery shopping whenever I need to. And I'm happy to say that I haven't personally heard or seen anything recently. Also, I've been going out much less because I'm trying to order more things online. But that doesn't mean that it's not still prevalent. Like, I follow a Facebook group, all these racist events happen every day, all the time, all throughout the country, where in connection with COVID-19, Asian Americans or people who look remotely foreign or brown skin, dark hair would be targeted to racist acts like that. So again, thank you for having this space to speak our minds and to voice concerns.
Thank you so much. All right, it looks like we have Jesus Rodriguez Jr. next. I'm gonna go ahead and unmute you. Jesus?
Sorry, hello, can you hear me?
Yes, we can hear you.
Okay, good morning. Hello, Brenda. Yeah, I'm a student learning with Brenda in her Health Ambassador Youth class. I'm also a worker in food industry, as well as working at Jefferson High School District. And coming from meeting, since I've been hearing mostly about healthcare due to testings and how difficult it is with results, and also I guess, housing, being part of a family that did recently got out of, luckily, being homeless a few months back. But besides all the talk of, shelter in place, medical access, my question, since we're starting school, students or family with kids, over the summer, we did free meals for not only students that qualify, but also for communities to help with families. I really don't know, but in a way, it was really helpful besides food distribution. Is there any way we can look into continuing that to help those that are in need of shelter, besides shelter in place, food access of, food drives, since by the looks of it, things are changing due to the start of school year starting in the next week or a couple weeks. So for someone working through the school district, I felt like that was really helpful, since a lot of people were lining up, but I know it's limited access. So I'm just seeing if there's any way we could figure out as a community to use school districts to help continue helping out throughout this COVID-19 until hopefully in the future it calms down.
Thank you so much. We appreciate you being here today and sharing your expertise with us as well. Next up, I have Dana Johnson. I'm going to go ahead and unmute you.
Hello, hi. Can you hear me?
Yes.
Great. Thank you for having me. My name is Daniel Johnson. My pronouns are they, them, theirs. Serve as a Pride Initiative co-chair and LGBTQ commissioner co-chair. I have a question. I think we've brought up and we've seen that there is a LGBTQ data that's needed, and now with the state, I guess, finally stating that they are going to look into trying to have ways and means of receiving that data. What are we doing in regards of trying to get that data? But I think I want to look at it from a different lens of not just the physical aspects of COVID-19, but the mental health aspects of that as well with the LGBTQ community. And I think, and broad the community, because I think a lot of times we're looking at COVID-19 as a physical health pandemic, which it is, but then there's also that mental piece too. And then also looking at those that, because of the shelter in place, may have to be in homes, but may not be safe in regards of maybe, let's say, domestic violence or youth in regards of abuse. So are there resources that can be provided in regards of that? I know Cora is doing some things, but very probably limited able of resources that they can do at this time. So like what is being done? Because again, that mental health, I think is really sticking out. I think on people. Not only are you worried about this testing, but then now you're in your home, then you're worried about work. You know, the mental health of a lot of individuals are also affected. So if we could probably look into that, as well as what we're doing, a lot of good things that sound like physically, but what things are we going to try to focus on mentally? And I think that would be it for me in regards of my question. Thank you.
Okay, I'm gonna go ahead and read a comment that came in through the chat. Someone's speaker isn't working. So Hallie had the concern is that about folks that are being released from prison without community discussing this issue. San Quentin has released 8,000 people. Some have come to our community. What do we think of this issue and capturing the number of people who may be infected without housing options? That was one concern. The other concern that she raised was it's difficult to keep up with the changes of opening and closing of the county. My participants are not clear on what is actually okay and what is not. Their doctor's appointments, the ability to leave the facility, and the risk factor that is greater today than it was in May. So we're gonna move on to the hands again. And Brenda, if you could put the slide on the community priorities, please, so that folks are reminded of that. I'm gonna go ahead and mute you, Trina Patton. Go ahead. Trina? Hello? Okay. We can't hear you.
Okay.
Oh, Trina, is that you?
Yes.
Okay, perfect. We can hear you now. Yeah.
Okay.
Yeah.
Hi, my name
Go
is.
ahead.
Hi, I'm Trina Patton. I am a Deputy Public Guardian in Aging and Adult Services. And I have a concern about our clients and folks in skilled nursing facilities in particular. They are, of course, an incredibly high-risk population, and the consequences of COVID for them are often fatal. I'm wondering if the county is doing anything to one, look at how to help facilities become and stay COVID-free, as well as looking at like why some facilities have been COVID-free since the beginning of the pandemic, and other facilities had rampant outbreaks, and then others continue to have a staff or a resident here or there test positive. It feels like in skilled nursing facilities, COVID is still just very out of control, and it doesn't seem that there's any plan to help contain it. So that's my concern. Thank you.
Thank you, Trina. We appreciate it. Okay, so we have about a minute left here. So I'm sorry that anyone that has their hands raised, please go ahead and submit your question or comment via chat. And we'll be sure to follow up with you after. The last thing I want to do in closing is we've talked about a lot of different stuff today, and I wanted the community priorities to come back on the screen so that we could just talk about them in the last minute that we have left. We've talked a lot today about access to testing, the timeline for testing. Dana talked to us about mental health support, as well as Lolan from the Pride Center and peer support as well. we talked a lot about internet and cell data access and the digital divide, and how that is affecting folks as well. We've also talked about cultural and linguistically appropriate resources and information. Mary talked to us about the one flyer in Spanish that she has that she uses. And then also a lot about basic needs. I think with the rent moratorium or the eviction moratorium potentially coming to an end sometime in the future, this is something that is going to be affecting a lot of folks. We had Reverend McCall talk to us about food security, right? And the impacts that have been felt in food banks, as well as some domestic violence concerns and response. So I think that we've captured everything within these categories. If you feel like you have something outside of these community priorities on the screen now that you would like to put in the chat, please do so. If you think that something was not captured within these categories, we would love to hear it. And we want these to be reflective of this conversation as much as they can be. Thank you so much for everyone that participated. We really appreciate your input. I'm going to go ahead and hand it over. Well, I think it's still me actually, but we'll go ahead and switch gears to Q&A for anyone that has to answer any questions that have already been posed, and if we have time, any additional questions. Louise, I know you wanted to respond to a few questions, so the floor is yours.
Sure, there were really a lot of great questions and also ideas, and I'll work with you all to make sure that whatever we don't have time to answer now, we can respond the way we did last time in the written document. But one of the first questions I think Charo asked is about whether people who test positive have access to hotel rooms the way we've been making available to folks who are homeless, and the answer is yes. There are 2 hotels that are currently being used for this purpose, and the county is actually looking to purchase a hotel. So that's one thing. There were a lot of questions related to testing. Actually, would you rather that I just, how do you want to do this? Should I answer a bunch of questions right now? Okay.
Yeah, all the ones you have answers to, we'll do that, and then
okay.
Yeah, we'll switch. Yeah.
There were so many questions about testing as well as really good ideas. One thing to mention, I think Nora brought up, that really there's a lot of apprehension about actually getting tested because of all of the risks that someone may face, and other folks mentioned about literally the fear of documentation status and a lot of that. And so we are actually trying to work on more proactive information, not just in written form, but other strategies for helping the community understand that they don't have to be afraid of this public health response, that its focus is to help them and to give more information about how. So I thought there were a lot of great ideas actually offered about what that should address. And it's just perfect timing because we have to mobilize to help people trust the process. There were a lot of questions about testing and the timelines. And as someone pointed out, yes, it's absolutely the case that the timelines have gotten more and more protracted. The state has actually changed the guidance as a result of that. It has to do with the fact that the labs that process the tests are super overwhelmed. And so the state changed the criteria, and so now there is a prioritization that happens, as one of the speakers mentioned. And the priority is for people who are sick and highly symptomatic or likely exposed. And at the bottom of the list is people who may be concerned and asymptomatic that may not fit into those categories. So we are actually working, the state runs Project Baseline. We don't run Verily in Project Baseline. It's kind of a partnership. And so what we're trying to do is work on some other testing strategies that can be more focused and more local and really targeted. And someone else asked whether we've learned anything from the HIV/AIDS epidemic and how to reach people in trusting ways and more focused ways and what kind of outreach we're doing. And so some of the new testing strategies are going to be extremely focused and local, and they'll be very aligned with where we're actually seeing the outbreaks, the housing situations and the really dense neighborhoods. where people are most at risk. And the hope is that with a culturally competent, linguistically, competent approach and very, very targeted efforts, maybe even like pop-up kind of situations, that we can be more effective. But it's really important that this group know that for the moment, the timelines are a big challenge, and the best way for someone to get tested quickly, if they actually really are worried about this, is to start by actually accessing it through their health system, including the county, for people who are uninsured and for people on Medicaid. And one of the things that we're going to do is try to publish more information about that, because Project Baseline is not actually the best resource if you are feeling, sick. And then Pam mentioned walk-up and transportation barriers, and that's absolutely true. And some of the new strategies will try to leverage more walk-up options, as well as support for people who don't have digital access. So those were some of the things on that topic of testing, which we know
Louise,
is
before we move topics, if it's okay, we have a follow-up question on how we can direct folks to access the hotel rooms if necessary, or what that process looks like.
People are going to be accessing that through public health and the contact tracing in the event that they're positive. We are going to be linking the people that, well, we are doing this already actually, but we're going to have a better way of linking people who are positive, because everyone who's positive, the results go to public health. And that's really where the contact tracing kicks off. And we're going to be linking people through that public health outreach to the housing resource. It's managed by HSA right now, Human Services Agency, but we're contracting with a nonprofit to be kind of the front desk for those hotel resources.
Okay, that's good.
Should I keep going, or there's a lot of really good stuff in here.
Francis, what would you like to do? Should we go ahead and keep going through the answers, or?
Absolutely. I mean, I feel like any reactions that Louise or Peggy want to share at this time, we have some time before we move on to next steps.
Okay. Yeah.
So one of the questions that came up was about people in skilled nursing facilities, and I think Trina brought that up about whether or not what's going on, with all of these folks that live in these congregate settings, including nursing homes. And I think what I think we should do is figure out a way to get more information out to the staff that work with the clients in those settings. But to make a really simple answer, we have been doing a full court press with those facilities. We've collected 9,600 testing samples, and we worked with 400 of the facilities. And the health plan is focusing on the nursing homes in particular. And the larger ones are trying to mobilize testing on their own of their staff and of their residents on a routine cadence. The smaller ones are going to be supported more by a testing resource that we in health are mobilizing to actually support the tiny mom and pop types of congregate care facilities and the ones that are less medically oriented. But I think the reason that we've made progress is that we have been really working closely with them to get them tested. And when there are positive examples, positive cases, to either figure out how they can work with those folks in place or to get them transferred into other residences where they can be safely isolated and quarantined. So that's really a big priority for us. And I think we're continuing to make progress on it. And there will be some new testing resources that are really focused on them. But I'll work with Lisa Mancini and Scott Gilman to try to get more information out to the folks that work with those facilities. Thank you for raising that. I think Dana brought up the issue around the data and the LGBTQ data in particular. I think people know from previous advocacy that we've sort of had to break through on the data front with multiple populations. And there are kind of two issues. One that arises very frequently is if there are small numbers, we have to manage that very carefully because it sort of outs people. There are ways to manage that. But with the LGBTQ data, the real issue is that it's not collected at the source. And so this is really a statewide challenge, and it has to do with like lab tests and the information that's collected when the lab tests are conducted, and whether that information includes LGBTQ data, whether the SOGI, elements are there, and then also, in the case that a provider system collects them, that they actually make it all the way through the big factory of test results and back to us so that we can learn from it. I do think this is, kind of a statewide advocacy issue, and probably like we have done, for example, with Pacific Islander data and other data, we might need to have a more organized approach to advocating for that at the state level. Transportation. So yeah, that is such a challenge. We have had a real challenge because for people who are tested positive, no one really wants to drive with them or drive for them. We recently had a breakthrough, which is to learn that Yellow Cab in Santa Clara seems to be really stepping into that space. And so here in the county, we're going to be contracting with Yellow Cab to try to provide more support for people who are positive around transportation, particularly to the hotel resources and out of the hospital when they need that kind of support. I know there were a lot of other questions. I think what I'll do is work with you guys to make sure that we answer them, online and in the written document. And please, thank you everyone for a lot of these great ideas, like around the information and outreach and how it has to be trust inducing for people to be able to want to even engage.
Yeah, thank you so much, Louise. One last comment I think that we're seeing is also folks being willing to use their community spaces, such as churches and different things, as community mobile testing sites, and how that could potentially break down some of the barriers for fear. And we definitely see that as an effective strategy as well. But
that's super helpful to know, especially because we've been leaning on spaces like school parking lots that over the course of the year really may not be available anymore.
Yeah, so we'll go ahead and get that information to you. In the last 3 minutes, I want to see if there was anything that came up in the Q&A, Maria and Shireen, that we might want to push forward within just the last couple minutes that we have.
Luis has answered a lot of the questions that have come up. There are plenty of questions, but one of the ones I wondered if you might have a response to is when people are isolating at home, but may not have loved ones or folks that can go out and get food for them and their medications. What are their options there?
So I mentioned earlier that we're trying to mobilize it's kind of a case management support for the people who need to isolate, but they don't have solutions for some of those problems. And we're trying to get the contract done, and we are hoping to start it later this month. And it will be really focused on the folks that have the greatest challenges in that regard. But we think that we're going to be able to make a lot of progress by helping people and paying for some of those supports that they need, which might include food, it might include getting medications picked up or that kind of stuff. A lot of questions in the chat about prison discharges. So I should also mention that that is something that is going on, and we are figuring out how to respond to it in the best ways. The good news is that the state system, the prison system, is communicating with us when there are any discharges of folks that would be either positive or be a contact of someone and be at risk. And so there is communication so that we're not, kind of blindsided by those kind of needs. And then we have our partners in the county are trying to stay coordinated about who's really assisting those folks. But if they are positive and if they have the needs that we've just discussed, anyone might have, those would be folks that we would be working with to help isolate and, have food and shelter and all of that.
Wonderful. There are a couple of questions about supporting youth. And one of them, a couple of them are specifically around whether or not there was an early mention of the fact that youth without being in school, especially LGBTQ plus youth who rely on committees at their schools and other places to congregate, but across the board, many of our vulnerable youth who need to connect to feel for their mental health purposes. Are there guidance around how they can connect, how they can effectively connect, and how are we reaching, sending that information out?
Well, this seems like a really important issue and one that we should talk about with our education partners. You know, they are kind of hands down focused on just the logistical issues and supports around education in the coming weeks, but I know that there really is a lot of attention going, you know, not to all different variety of youth populations that might need special supports, including children with special needs, etc. So I think this is a great example of a topic that we might want to explore further with BHRS and education partners, you know, kind of as a, you know, take a focused approach to it and leverage in the example that was given, you know, the Pride initiative to be able to actually get the word out more. There are some things that are available that we have tried to push out. One in the Bay Area is our Crushing the Curve campaign, which is targeted at youth and young adults, and it is intended to be more support, you know, than a heavy-handed kind of like face covering messaging sort of thing. It's intended to meet needs and support people to meet needs. And so one thought would be maybe we could work with that initiative to try to get it to be more of a focused support for that population. But I think it's worthy of a lot more conversation.
Awesome. So I think if there's nothing else, Shireen, nothing else from the Q&A, I think I'll pass it over to Francis.
Thank you.
And we'll get you the rest of the information as well, Louise. Thank you for taking the time to answer those questions.
Thank you, guys.
Thank you so much. We are going to move on to next steps now, but I think that I speak for all of the planning team, all of our partners here today, and that we're just so moved for all the community input that we've received in the last hour, for your vulnerability and just your willingness to share. So I feel very humbled and just very special, along with my partners today, to be able to be here with you and to listen. We will be capturing all of the questions in the Q&A and the chat, and we will be supporting Louise and sharing the information and hopefully providing a summary or document as a follow-up to this meeting. So as we're wrapping up, big thank you, and also big thank you to Tanya, our colleague Tanya, for doing an amazing job in supporting our discussion. I'm gonna put up a poll of 4 questions. If you could all take a look at that now, and it's really to understand how you'd like to be involved moving forward, and also how you would like to receive information in the future, and also what region of San Mateo County you're representing today. So if you can take some time to complete, that would be super helpful. I'm going to turn it now to Brenda to talk a little bit about our upcoming Diversity and Equity Council meeting.
Wonderful. Yeah, thank you so much for everyone that was part of this event and that made it happen. And a shout out to the Half-White youth who showed up today. Thank you. Yeah, we'd like to, as a way to have a space to continue these conversations and brainstorming about best ways that we can come together and support our community, we'd like to invite you all and remind you all of our Diversity and Equity Council that meets once a month on the first Friday from 11 a.m. to 12:30 p.m. And you can see the meeting information online. Our next meeting is actually scheduled to meet Friday, September 4th. Yes, please join us, and so we can continue this conversation. And so the information is here on the slide, and you will also have this information after the presentation. Thank
you, Brenda. Yeah, absolutely. So we're going to be sending all of this out. In addition, we will send an evaluation so that you can let us know what you thought of the event today, and also the follow-up materials, as I mentioned, and information on the rest of our health equity initiatives. Also, the Diversity and Equity Council, Brenda and I, will be supporting a live PSA on this topic coming soon. So more details to come. And so with that, I would over to Dr. Maria Lorente Foresti, our Director of the Office of Diversity and Equity, for a closing exercise.
Hi, I want to start by just thanking everyone here for their courage and vulnerability and their voice. It is so important for us to be guided by each of you, and that was really what today was about. And you know, I think Alejandra Garcia touched on so clearly the emotional and mental health impacts on all of us due to the pandemic. And so as a result of kind of thinking about that impact, we invited Cindy Donis to join us, who is a licensed and marriage and family therapist who has expertise in trauma, and she oversees our Trauma and Developmentally Informed Training Program, which is called Neurosequential Model of Therapeutics, or NMT. And so we're really excited to have her here so that we can end with some grounding and some calm, and hopefully we can use this also in the days that come that may be stressful. So I'm happy to welcome Cindy.
Hi, everyone. Thank you for having me here. And I have to say it was a privilege to just listen to the community. And with that, I think it's easy to say that we all have experienced ongoing stressors, probably more than we have at any given point in our lives. And so the exercise that I want to bring to you all has some good research behind it, and it's called security priming. And so what I'm going to ask you all to do, if you feel comfortable, and please opt out if you don't, is to recall moments of love and nurturing throughout your life. I will guide you through that. But before I do, I just want to say that the research actually shows that when we bring up people and moments where we have been nurtured and cared for, it actually can help us feel or increase our sense of security even under stressful circumstances. So this is something that I've been encouraging people to practice throughout their lives, because we are in times of increased stress. And when we bring up these moments and memories of care, it could actually reduce the sense of threat and increase our sense of security. And more so, the research shows that it could actually decrease hostile and aggressive behaviors towards people that are different from us. And it actually helps us take in unfamiliarity and be much more flexible to hearing differences, which I think we need so much in our world. So with that, I'm going to ask for those of you that do feel comfortable to go ahead and close your eyes, or at least lower your gaze to an object that's not moving. And go ahead and begin to go within and start to notice your breath. Take a few deep breaths, inhaling and exhaling much slower than the inhale. Go ahead and take 3 more slow, deep breaths. Now I want you to bring to mind someone who loves you. It could be someone from your life now, or someone who has loved you in the past. They can be friends or family members. They could include teachers, counselors, and even pets. And bring up the memory of what it was like when they were providing you love, care, nurturing. perhaps they were looking at you in some way, holding you, supporting you. And as you imagine this person, as you bring their memory back, the person or a pet, we're going to activate that memory more by bringing in your senses. Notice what you see when you are with them. What do you hear from them? Notice the sense around you when you are with them. What do you feel in their presence? Take in this person's loving presence and remember what it's like to be loved, to be cared for, and to be seen. Go ahead and take a deep breath in again. And when you are ready, bring yourself back to the room, orienting yourself to this time and this place. Open your eyes. And bring yourself back. We did not have the time to give this exercise really like the strength that it can carry. So I really hope that you can practice this. And when you do, just make sure two things come to mind. One is incorporate your senses. It will really make the experience more alive. And two, if moments of loss or disappointment come in, just acknowledge that they're there and gently move them out. So thank you all again for having me here. And I really hope that as you practice security priming, you notice that your own sense of security increases even amidst stressful circumstances. Thank you all.
Thank you so much, Cindy. Really, really appreciate that. It's a perfect way to just come back to our center after such an important conversation. So we are at the end. I'll share before I turn it over to Brenda, just a big, big thank you to all of you for being here today. Big thank you to Louise for the information and her willingness to listen and just be present here with us today. So big thank you. Please go ahead, and if you have any other feedback or anything you'd like to share that you didn't have the opportunity, please go ahead and email us at ode@smcgov.org, which is on the screen now. And I will turn it over to Brenda.
Awesome. Thank you so much, everyone, for being here. If you are interested in joining our email list, please log online so that you can see the address on the screen. And then if you wanted to join any more information for DEC, you can reach out to me directly. I will enter my email address in the chat box. Thank you so much.
Thank you, everyone. Have a wonderful day, wonderful weekend. The rest of the planning team, if you would like to share some parting words, thank you so much.
Thank you. It was great working with everyone, and thanks everyone for their participation. We look forward to working with the community and our government representatives in the future.
Thanks, everyone. It's been so lovely to learn from all of you, to really have your expertise heard, your voices heard, and such good questions that we need to get more answers to. Thank you.